Hey guys, Dr. Berg here. In this video we're here with Justin and we are going to show you how to do an evaluation. So many people, when they get an evaluation, they go to the practitioner and they give them a list of things to take for their symptoms. So what I want to do is I want to take all this information, crunch it, and come up with a root cause versus treat the symptom. Justin, we talked before. Can you tell me a little bit about your main problem? I think you said it's almost like a anxiety stomach, or it's in your abdomen. Can you tell me about that?
Yeah, correct. I mean, it's just a persistent feeling, kind of like a tight knot. Sometimes it's really tight, sometimes it's kind of a throb. It'll manifest itself as shooting maybe through the back sometimes with tingling. Sometimes it comes up the chest into the shoulder area a little bit. And just an uncomfortable, anxious feeling.
Got it. Okay, so does it come up to here? Does it ever come up to this point, this muscle right through here?
Rarely. I do have an issue with my neck because I
here?
have a strain in my neck. So it would be hard for me to tell if it was actually coming from this area or whether it was just a result of this small injury I have here, possibly large injury I have in my neck.
You got an injury right here?
I have an injury in my neck right here. So you can
on
actually,
the right side or the?
If you can feel, you can actually hear that.
Yeah. What happened to your neck?
I don't know. It was just like almost like I was slept on wrong, and then it just kind of got worse.
So it really wasn't an injury. It was just like sleeping wrong, and then you started hurting.
Yeah, and then it started hurting, but it's been like that for a while. But it's actually something in there. You can hear it.
Yeah.
You can hear it crunching.
Yeah. Okay. Good. We'll come back to that. I always want to kind of differentiate, like when people say I have an injury, and then you find out it wasn't really an injury. You slept wrong. Why would the neck still hurt from sleeping wrong? Right? That doesn't make sense. Next question, does this sensation, it's like always there, or does it come and go?
It's always there, but it will raise and lower at certain times of the day. Say I'm maybe in a higher pressure situation, it will exacerbate that. Yeah, like stress or anxiety kind of doubles up on it, but it's always kind of there. Like I can feel it in the morning, I can feel it at night before I go to bed.
Okay, so the next common question we want to ask is, when did this start?
I've probably had it for the last, I'd say, 3 to 4 months straight, as a persistent thing. You know, I've always had it on and off, but you know, the persistent feeling down there has been for quite some time now.
Okay. Now, what about when did it first originate, where you didn't have it and all of a sudden you had it?
I would say I've always had it on and off.
Since you were born?
No, probably since probably my mid-20s, mid to late 20s. It's been on and off, but I've had periods where it wasn't there, and then I've had periods where it's returned. But this is the longest I can remember, probably for the last 3 or 4 months, that it's been a persistent issue. Got
it. How old are you now?
37.
37. So it started in your mid-20s. Do you remember like not having any issue at all, like in your early 20s?
Yes and no. I mean, there was we were wild people then, so it was, there was always something going on to detract from that. But less in the early 20s, and maybe kind of ramping up as I went on.
Okay. I'm trying to get to like an exact point it started, and it's maybe hard to find that exact point. Okay, so we have that information.
I would nail it down to the late 20s, though. I would say, probably around 28.
Great. That was the year that I started going downhill too myself. Okay, so late 20, or actually 28 years old. Now, the next thing we want to find out, of all the things that were different or things that changed right before that happened, was there anything that happened food-wise, stress-wise, that could have triggered this?
Well, I was on, actually, I was with my wife at that point, or with my then girlfriend. I had a pretty hefty drinking habit back in the day, and when I started trying to curtail that or change my habits in that, I think I sent myself into a bit of a, emotional and physical upheaval within myself.
Okay, so there was definitely a stress, there was some drinking, stress, back and forth, that whole thing, which makes sense. During that time, was your eating like perfect back then, or is it slightly off?
Oh no, I've never had. My diet is probably something that needs improvement even today.
Okay. Now, the next question is, I want to get a related symptoms. Like, do you have any other body issues? For example, fatigue, sleep, itching, burping, constipation. Do you have any other symptoms?
No, not right now. Like I said, I've been taking a SSRI recently, and I've been on and off of them. And when I was off of them before, I was on tried Lexapro first, which made me super tired. Then I went on to Paxil, which seemed to have little to no effect. Then I went off the Paxil. I weaned myself off of that. I was off that for about 2 months and slept fine, which was the best sleep I've gotten in a long time. Just the persistent feeling down here, really no other issues.
Okay.
Maybe some occasional fatigue, but nothing like what I was experiencing on the medication.
And you're taking these medications for this problem?
Right.
Okay. Because it kind of made you anxious.
Mm-hmm. Exactly.
Okay. All right. So a couple things I want to just kind of educate people on. Number one, there's almost like a second brain in your gut. There's 3 parts of the nervous system: the flight or fight, the recovery part, which is called the parasympathetic, and then there's something called the enteric, which is all digestion. There's all the nerve connections that go right up to the brain. So a lot of how you're feeling up here, your focus, your mood is related to here. So now I'm going to ask, his diet's probably been bad for many years, but what about, do you have a history of antibiotics?
No.
Okay, good. Do you have a history of any type of constipation?
No.
How often do you eliminate per day?
Probably 3 times.
Okay, cool. Sometimes I'll say that says, oh, per day. I do once per month, and I'm like, okay, that's a problem. All right.
It's actually become more regular in the last probably year or so.
Okay. And then now comes the big question, what do you tend to eat for breakfast?
Breakfast, I've got sometimes a Costco Danish.
Okay.
Sometimes I eat the Bella Vita biscuits.
Mm-hmm.
Occasionally McDonald's, but nothing, nothing good.
I was actually there last night because we were going to get some Pellegrino water and some other things. And I looked at this rack of Danishes. It's like it was like this huge selection. I'm like, wow, there's actually a lot of people buying those Danishes.
And they sell out of them too. There's a ton of people buying those Danishes.
Amazing.
I'm one of them.
Amazing. Okay, so then for lunch, what do you eat?
Lunch, I usually try to eat something with some chicken in it. I work in a restaurant, so I have access to healthy foods there. So during lunch is probably my best meal of the day. So I'll try to get some greens, some chicken, occasionally some red meat, rice and beans.
Okay.
Is usually the lunch thing.
Good. Then do you eat a snack or do you just wait till dinner?
It depends because with my work schedule, and I have twins that are a year old, so whether I'm at work sometimes, because dinner time is the busy time at a restaurant, and when you're with the twins, it's just if they're going to let you eat or not. So it gets pretty shaky at night. Sometimes I don't even eat dinner at all, and I skip a lot of meals. And my appetite, I've also noticed that my appetite has decreased ever since this became a persistent thing. I dropped about 15 pounds. So.
Wow. Okay. Do you feel, so you skip meal, do you do like binge at night for snack then when you get home, or?
Occasionally, yeah.
Okay. And what do you normally snack on, like carrots, celery, or?
No, sometimes like even at night I'll hit fast food on the way home, or I'll eat a sandwich at home, like a ham sandwich. Usually eat good whole grain bread, but it's usually chips or something like that with that glass of milk. Okay.
And then do you crave anything?
No, and that's been kind of one of the biggest factors of this. And I wasn't sure if it was the medication I was on, but it seems like the signal that's supposed to come from here to the brain saying, hey, it's time to eat, doesn't really get there.
Right.
When I go to eat, I'll eat, like, you know, I'll eat like a horse when I go to eat, but I don't feel hungry.
Right. That's one of the side effects because it throws off this thing over here. You're trying to fix this and it gives you another problem. So how many actual cups of vegetable do you eat per day?
Vegetables, I'd say about 2.
2, okay. Are they canned? No, it's good.
No, we keep, you know, that's another good thing about, you know, the babies eat great. So we usually keep a lot of fresh fruit and vegetables in the house for them, so I'll snack on that as well.
Okay. Okay, so now right now, do you feel this sensation? Like,
yeah.
As you're sitting there? Mm-hmm. Is it like a tight knot, like a deeper tightness?
It's kind of more, it's like here, but it's more in the back right now. Where It's almost like a tingly burning, and then it's kind of a real light, dull sort of sensation here, kind of like a throbbing sensation.
Okay. 10 being really, really severe, 0 being no problem. How would you rate it right now?
Right now,
the front part.
It's probably like a 3.
Okay. All right, so I'm going to do an experiment. I'm going to press on this point right here. You can kind of sit up a little bit. I'm just going to press right here. Is that sore right in here?
A little bit. I mean, yeah,
Right
I can feel like a little sharp pain.
Yeah. So how about there, here? Does I? Yeah, right through in there. Okay. So now what I want to know, go ahead and re-rate the pain on the right side. Give me a number. Was that a 7? What is it at now?
I'd say it's about, it's funny, it's like it's moved like here a little bit.
Okay, but right here.
Right here, it's less.
Okay.
I'd say it moved down 1 to like a 2.
Okay. All right, so here's the thing. This is only like, could be like 3 things right here. You have the gallbladder right here, you have the liver, and actually there's 2 things right there. And you also have the kidney right here. So in my mind, I'm thinking kidney stone possibly, but I don't know, maybe that's not it. Gallbladder, because gallbladder will refer pain right up in here, and this will keep this really tight, because there's a nerve called phrenic nerve that goes right up through here. It comes right into the back too, especially between his scapula right through in here. I don't know, do you ever have anything right here?
Yeah, no, I mean, I feel a lot of that tingling too will, you know, come up through that area.
So that's liver and gallbladder. I mean, when you talk about the gallbladder, you can't have a really sluggish gallbladder and a healthy liver. So if one's down, they're both down. So I think with him, I think it's gallbladder and liver. That's the most likely thing based on the history. And even if you did a scope, they might not find gallstones. But if they did a functional test where we see the release of bile, it might be constricted. And that would create an internal tension and full feeling and a tightness that will make him feel anxious, because this area right here is next to the diaphragm, which actually affects the breathing. So it might be hard to breathe sometime, and you might just feel like I can't just relax in my gut. So it's going to prevent him sleeping through the night. And on top of that, they treat him for anxiety with a drug, and they camouflage the whole thing. So we don't even know what's going on. But the fact that he has pain right here, up through here, that's all gallbladder. And the reason I press on the opposite side is that's how you actually treat it with acupressure. You never press on the gallbladder. Well, you do, but if he has a problem here, you can press on the opposite side. It'll start draining the gallbladder. So I just did like about 6 seconds of pressing just to see if it created a change. Ideally, what he should do on the couch or on the bed is start doing massage all through here till this completely drains. Okay? And then I'm going to put him on an eating plan that will start to slowly build up the liver and the gallbladder. All this will go away. I do not think he'll need those medications at all after this, because if he has no sensation, there's no anxiety, no need to take that. But obviously, based on the history, that's the most likely thing that I would recommend. Does that make sense?
Yeah, it does.
Okay. So, so let's just give some recommendations. So for food-wise, are you hungry in the morning or not?
It varies. You know, I can eat. Like
Okay.
if I go to eat, I can eat in the morning, but a lot of times, you know, I won't. It'll be kind of we have the kids in the morning, and once you get the kids, you're out the door.
Yeah.
And there's not a lot of time for
I had 3 kids. I totally understand that. It's like, you handle him, I'll handle this one. Like, it's impossible. So for breakfast, I think the best thing, can you do eggs?
Mm-hmm.
I would do eggs and cheese, because it seems to be somewhat healthy and some protein. I think that'll at least help you. But because if you don't eat for breakfast, and let's say you are hungry and you don't eat and you just don't have time, in the evening you may possibly snack on things that you shouldn't be eating. That's a possibility. So we want that. And then for lunch, what you really need to do to fix the liver is we need to severely increase the vegetable in your diet. So if you have access to food, do you guys have any like big salads you could eat? Mm-hmm. So I would eat the salad first. And I'm talking like a big salad. I consume about 7 to 10 cups of vegetable every single day. So we need the big salad, have your chicken, have your protein, and you're good. Dinner, same thing. Vegetable, protein, some fats. But we don't want to do any junk food. That's the thing. If you keep that in, you're not going to crave at night. That doesn't look like you're trying to lose weight, so I think you could probably do fruits too. But I would make sure in your house that you don't have any junk in the trunk or anything junky. Just really make sure that it's almost impossible to go for that junk because you have all good food. Mm-hmm. But I'll send you kind of like a list of what that means. But yeah, for the liver, you need, the main thing you want to add in addition to the protein is a lot more vegetable and probably some nutritional support for this and some acupressure. I think this will resolve it probably very, very quickly. But the last thing I want to point out is that it takes 3 years of healthy eating to completely rejuvenate your liver. So when you do this for like several months and it feels good, like you have to maintain it over at least 3 years. You'll have a brand new liver. Sound good?
Yeah, sounds great.
Okay, well thanks for watching. So that was an example of like how you want to evaluate and pull a string and give recommendations. I'll see you in the next video.